So if you haven't been to the Access Harris website, you've been missing out on a lot of services that can potentially make a very big difference in your life. It's a collaboration of what they call wraparound services of partner agencies to help many people get the help they need when they need it. Joining me this morning to talk about it is Barbie Robinson. She's the Executive Director for Harris County Public Health. Good morning.
Good morning.
Thank you for coming in to be able to talk about this.
Me.
Hey, before I get into the Access Health program, I want to compliment you on preparing for what you do in life. You listen up here. Triple major in your Bachelor of Arts in Political Science, Spanish, and International Sociology. Before you got your master's degree in public policy, before you got your law degree, how much of that academic preparation is helping you now do what you are doing and passionate about today?
I think that my academic preparation was foundational to spurring my interest in wanting to make change in our government programs, in government. There's so many opportunities for us to have an impact, whether it's grassroots organizing, but I really, from my studies, learned that it's really important to be at the table to set policy and to develop programs that have positive outcomes from the very beginning.
Personal experience giving you a little bit more passion about this as well?
Yeah, I was raised by a single mother, and we found ourselves in need of public benefits. And when I think about the fact that my mother worked 2 jobs and that still wasn't enough, and the efforts we had to put in to get government services, I really wanted to be a part of a system to design programs that allowed folks to, become self-sufficient or improve their well-being.
So Access Health, Harris Health, what makes it unique in the way that it can provide access? I know using the partnerships is really kind of fundamental.
Yeah, so we currently, Harris County Public Health partners with other county government safety net agencies, those that are providing public benefits to individuals in the community. And what we do is we come together as a system rather than siloed programming. We come together and create a coordinated, holistic approach by bringing our frontline staff together to create coordinated goal setting for vulnerable populations that we share, but currently operate in silos in serving them. So we get out of our individual swim lanes, and now we all jump in the pool together to do synchronized swimming to really help support individuals.
So what's the challenge of making sure that people who need these services, who oftentimes are frustrated about not being able to get what they need, how is it going to be possible to help make sure that they know how to get this access? That's going to be one of the challenges.
Yeah, so what we learned from COVID is that COVID didn't cause health disparities. They magnified the need. And so we knew that we needed to get to vulnerable populations and underserved communities. And we established a blueprint in terms of our community engagement and how we engage with organizations that reach populations that historically have not had access to services. And so we're leveraging that model to reach deep into communities, to find the most vulnerable, to find the most underserved, and share with them this model of care that really reduces the barriers to get into the system and getting out.
So I noticed the website is important as a part of that. One of them is, it says a lot of useful information, by the way. This really gives some insight into the areas that are really important right now. The maternal child health program, which is on the screen now. Part of the challenges faced by Black women in their maternal health. Talk about the focus on that area and why it's so important for people to know that this program exists and what they can get, how kind of help they can get.
So for Black mothers, birthing persons, Black infants, they have a disproportionate, really high rates of mortality. Black moms die at a rate 3 times higher than their white counterparts, and Black infants die at a rate of 2.3 times their white counterpart. We are in a national crisis. Harris County has the highest Black infant and Black maternal mortality in the state, and our numbers are also very high relative to the rest of the nation. If Harris County, Wayne County, which is Detroit, Michigan area, and Cook County, which is Chicago, Illinois, if we collectively reduced our Black infant mortality by 9%, the entire country would achieve equity in Black infant health rates or birth rates. And so this program is really important. We're sounding the alarm and really focusing our efforts on addressing those determinants that result in the poor outcomes, from discrimination to addressing the social determinants, stress, trauma, and bringing a holistic model for those individuals.
So is your priority now, one of the priorities, is to make sure that people know that Access Harris is there and how to get there, and how do they do that?
Yes, so they can reach out to the health department directly. As you mentioned, our website. We have a number of community events that we're planning where individuals going to the community events where we know populations that would qualify for these programs, frequent and outreaching that way. But again, they can reach out to the department either by calling us directly. We're ramping up for a number of events to reach the populations that we want to reach to enroll in these programs.
Very impressive program, very impressive director. Thank you for coming in. We really appreciate what you're doing. And you're going to come back in the fall because we have some more things to talk about, right?
Absolutely.
Okay, so you heard it. She's coming back in the fall. We look forward to it.
Thank you.
Director Robinson, thank you for what you're doing, and good luck as you continue to push the envelope to make positive change. We appreciate that.